Oh, lots of people showing up. Thank you for joining us. We're just waiting to get started. If you just want to say hello, you're welcome to say hello in the chat. We'll be able to see it. How are you, Leslie?
I'm good. How are you?
I'm doing well. You know, got my hair cut this morning. That was fun.
That is great. As you can tell, I have not had that pleasure yet.
It just feels nice to feel the air on my scalp again.
I am sure. I am looking forward to it, but I just haven't gotten out there yet.
Yeah, my wife has an appointment on Friday, and it's literally like this big circle on our calendar. She's like, nope, like Christmas. All right, we'll just wait 30 more seconds, and then we'll get started. I see a lot of people I know. It's good to see so many familiar faces or names. Hello, Melissa from North Bay. Things are nice up there. All right, shall we get started? Well, hello everyone to the webinar for the 7th poll we're doing on the state of mental health in Canada. I don't know how many of you have joined us before. This is our 7th poll that we've collected going back. Our first one would have been in April 2020, and we'll be continuing this work with the support of Health Canada until March 2022, which will be in total 12 polls over the course of it, so we'll have some continuity throughout it. My name is Michael Cooper. I'm the Vice President of Mental Health Research Canada, and I'm joined today by my colleague, Brittany Saab, and our partner on this, Pollara, Leslie Martin, who is the Vice President of Pollara. So if you have questions during this, you're welcome to put them in the chat. We'll be monitoring the chat as we go, and if you we'll be making this webinar available after it's concluded. And as well, the report we're going to show you today in its entirety is available on our website, MHRC.ca. If you go to National Polling COVID, you can check it out. Also there, we'll have our interactive data portal. So if you're interested in playing with the data yourself, you can manipulate it by age, gender, and province. So without further ado, I'll get started on a few of the major findings, and then my colleague Brittany will take it from there. Thanks so much. So this would be the methodology. It's a lot of numbers on one page. In short, we had 4,000 participants in our poll 7, which ran June 7th to June 13th, 2021, which you can see on the right-hand side of that page there. We do some minor weighting for demographics, but it's not generally required because we have pretty good input controls to make sure we're getting a representative sample. So there's not a lot of weighting that's going on here. We do a national representative sample of 3,000, and then we partner with multiple provinces. In this case, we partnered with, I think we partnered with Nova Scotia, and we partnered with Saskatchewan this round for poll 7. So you'll see there's additional sample in those provinces, which we've accounted for in our weightings. Moving on. So the major findings. So this was exciting. This was the first time we'd seen a significant drop in self-reported anxiety, which we categorize 8 to 10 on a 10-point scale. It went from 28 to 24% from April 2021 to June. Sorry, April 2021 to June 2021. When you break out the demographics, the primary driver of the reduction in anxiety was almost entirely in the 55+ category, where anxiety has dropped while it remains elevated for most other age groups as well. The other thing we identified, of course, was that in Ontario, in April, we were in the midst of a significant lockdown, and anxiety was very high, it was 33%. Depression was also high. It has now dropped in Ontario, although Ontario does remain the province with the highest degree of anxiety and depression, which is something we've seen, especially with lockdowns. It's more tied to lockdowns than actually case counts in terms of self-reported anxiety and depression. Brittany, you want to take it from here?
Yeah, sure. So one of the major changes in this poll was that kind of due to the anonymous nature of our polling, we were given permission to collect data from 16 and 17-year-olds, which got us some very, very interesting results. One major thing was that though Canadians in this age group are less likely to receive a diagnosis, levels of both self-rated anxiety and depression are very high. In fact, levels of self-rated depression are the highest in Canada, and self-rated levels of anxiety are just below those of the 18 to 34 age group. We're going to be sharing some more on 16 to 17-year-olds later in the webinar, but that's just kind of an overview. Also, since the last poll, we have been looking at levels of vaccination since the push to get Canadians vaccinated has begun in April. We wanted to look at levels of vaccine hesitancy as well as try to understand the levels of self-rated levels of anxiety and depression based on that hesitancy, and we found some really interesting results. So one thing that we found was that there is a correlation between Canadians who are reporting high self-rated levels of depression and those who haven't yet received a vaccine dose. So Canadians who have received both or have received one are showing very similar levels of self-rated depression, around 15%, and those who have not received any are around 19%. And further, we broke it down by levels of hesitancy between people who haven't gotten one yet and are planning to, and those who are concerned about it and might not, and those who just are not planning on getting anything. And we found that Canadians who are not planning on getting a vaccine, their self-reported levels of depression were higher than the rest, around 22%. So in poll 6, we started to ask about suicide ideation and found some very troubling results amongst younger Canadians between 18 and 34. We found the results from this poll to be quite consistent with poll 6, and that 20% of younger Canadians between 18 and 34 have thought about suicide in the past year. And since we have been able to look at 16 and 17-year-olds, we have found more concerning results that 33% have actually thought about suicide in the past year. So that is something that we are going to continue to watch, of course, some concerning numbers. Something we've also been looking quite closely at are frontline healthcare workers. Their levels of diagnosis since COVID began have increased significantly. And even since our last poll, they have increased by 10%, up from 30%. Something that's interesting about this is that high levels of self-reported anxiety have actually decreased, while diagnoses of anxiety have increased, which is kind of indicating a lagging indicator following months and months of high levels of stress. And another change in this poll since poll 6 is that we are getting enough, getting enough data on LGBTQ identifying Canadians to start to do an analysis. And what we have found is very high levels of self-rated anxiety and depression compared to the national average. And later on in this, we'll see that an internal analysis has shown pre-COVID and post-COVID levels to be dramatically different. So unless Michael or Leslie want to add something on the major findings, I'm going to continue on.
Leslie, do you have anything to add?
No, I think Brittany covered it quite well. Thanks.
All right. Michael, you good?
Yep.
All right. So I'm going to, since we're going to cover most of this, I'm going to skip over a lot of this text and go into our details unless anybody else wants to jump in on anything that was there.
I just want to add that the details that we have here, for a comment I just added to the chat. All of this is, we're just showing our poll 7 report, which is on our website, mhrc.ca. Just look for poll 7 report, national polling COVID, and you'll be able to read that text. It would take 2 hours if you read everything on it.
Okay, so We looked at levels of diagnosis of anxiety, depression, or other mood disorder, personal diagnosis or family diagnosis. And that what we found is that it has increased across the board, but most specifically with anxiety disorder and depression by 6% for personal diagnosis and 7% for family diagnosis. I think this slide's pretty self-explanatory unless anybody wants to jump in and add anything. I'm gonna keep going. All right, so we also wanted to understand which Canadians were most likely to receive a diagnosis of anxiety or depression. And what we found is pretty consistent with our past polls in that females, even without the COVID context, are more likely than men to receive a diagnosis of anxiety or depression. Since COVID, the numbers have been fairly similar amongst men and women for diagnosis of both anxiety and depression. Excuse me, if anybody has been following our social media over the past while, you've seen that we have really been pushing an awareness of the mental health challenges of younger Canadians. And this continues with diagnoses of anxiety and depression, and that younger Canadians are much more likely to receive a diagnosis than Canadians who are 55 and up. And that's in both anxiety and depression. We looked at people with Canadians with children and found that, sure, due to many factors, Canadians with children are more likely to receive a diagnosis as well. And it didn't seem to be too dependent on the age of the children. There's minor differences. Frontline healthcare workers, as we mentioned before, diagnosis has increased significantly even over the past, since our April poll, and quite significantly since the beginning of COVID as well. And in terms of depression, looking at Ontario again, highest levels of depression in Canada, while Quebec is the lowest.
Just to add here on that bullet where it says Canadians with children under 9, 28%, then 10% increase since COVID-19. And then it says -17, that would be children under 17 and above, so 10 to 17. We just short formed it there, but it's not clear.
Okay, we've also found that of Canadians who have received a mental health diagnosis, 1/6 are, almost 3/4 of Canadians who receive the diagnosis are getting treatment for it. And the most common course of action has been prescription medication, followed closely by speaking with a medical professional. And of Canadians who have received a diagnosis, 11% has been in the past year, so around since the beginning of the pandemic. As we mentioned before, anxiety levels have decreased since our first poll, basically. Not that they're lower than they were in our first poll, but it's the first time that it hasn't increased. So anxiety levels of high anxiety are at 24% now, whereas poll 6 is at 28. We can see that depression is pretty much the same. It hasn't moved outside of the margin of error. So remaining pretty consistent there. Again, looking at people who are most vulnerable to anxiety and depression, we're looking here at people who have rated their anxiety and depression as high. So again, we're looking at women and young Canadians are quite vulnerable to high anxiety and high depression. Ontario residents in both anxiety and depression are self-reporting high levels of both. Frontline healthcare workers, though it has decreased, is still quite high. And also members of the LGBTQ2S+ community. We did an internal analysis on our data from polls 6 and 7 and found that high self-rated anxiety before COVID was 9% and has increased to 37%, which is quite significant. And levels of depression pre-COVID were at 11% and have increased to 28%, which is also quite significant. One of the factors that we concluded might be lack of access to community support, among other things, of course.
I'll jump in right there and just ask if, first off, if Leslie has any questions or anything she wants to add.
Nope, I think it's good.
Sure. Leslie does the primary analysis for us, so hence we turn to her to if there's anything we've missed in the nuance. I'm just going to pause here and just ask if there's any critical questions. You can fire them into the chat or the Q&A, and we'll check them. So if you have any questions, please fire them in. We'll wait like 20 seconds, 30 seconds to see if any questions come in, and if not, we'll continue on. Right, I don't see any questions. Let's continue on.
Anyone? Okay, here we're just looking a little bit closer at the provincial breakdown. As mentioned before, and Ontario is experiencing the highest levels of both self-rated anxiety and depression. And though it has decreased a little bit since poll 6, it is still quite high. The decrease, could be a factor of vaccination rates and as well as restrictions kind of starting to be eased. Hopefully by the next poll, we'll see that has decreased even more. And Quebec also continues to show the lowest levels across the country. Here's a little bit of a closer look at our analysis of 16 and 17-year-olds in Canada. As we mentioned, they are less likely to have received a diagnosis of anxiety or depression, but are experiencing higher levels of self-rated anxiety and depression than almost all Canadians, with the exception of anxiety. Is just a little bit lower than those 18 to 34 years old. Through our GAD-7 and PHQ-9 screeners, we have found that 16 and 17-year-olds are more likely to experience symptoms of a severe mental disorder, and half are feeling that their mental health is impacting their ability to function on a day-to-day basis. And that includes almost 3/5 feeling impaired, and 14% saying that they're actually losing days due to their mental health, which is higher than 18 to 34-year-olds. Again, as I mentioned, the rates of suicide ideation are very concerning among 16 to 17-year-olds, where 33% have thought of suicide in the past year compared to 20% of 18 to 34-year-olds. And what's, of course, even more troubling is 6% have planned a suicide attempt in the past year. So, and one thing to consider is that paired with all of these challenges, 16 to 17-year-old Canadians are showing to be less resilient and less able to cope with, managing stress, anxiety, and depression, and that's even pre-COVID.
I would pop in here to say that from our perspective, 16 is as young as we can collect using this methodology. So for us, the question isn't so much what's just happening with 16 to 17-year-olds, but what's happening to 12 to 15-year-olds, which is a sort of we have some data. There are some analysis that are starting to come out around that. A lot of smaller scale stuff, a lot of people with existing diagnosis, some longitudinal. But certainly, as someone who watches this data, it didn't feel like we hit that plateau of challenges. And our hope was when we started collecting 16, 17-year-old data that we would start seeing a curve downward, but it was still rising on the number of factors. Leslie, is there anything you want to add on this?
I do want to just mention that we are looking, because we've only done the 16 to 17-year-olds in this poll, it is a relatively small base size of, I think it's about 82 people. So it is statistically reliable, but when we look at it compared to the other age groups, it is much smaller. But as we go, we will combine this data and see if we can get a bigger sample size to really dig more deeply into what's going on there.
Excellent. Agreed.
And I'm just going to pass this over to Michael for the next couple slides, if you don't mind.
So this is the Kessler Psychological Distress Scale. which is something we've continued to use since poll 2. What's fascinating to me is I always look at the number of Canadians who are in that moderate to severe mental disorder. So what we look at specifically are the people who have rated 8 to 10 on the self-rated scale. And we try to understand whether or not the people who are reporting high anxiety or depression are actually experiencing the symptoms that would be consistent with a moderate to severe mental disorder. And what we find is it's sort of ranged between 60 to 65% of people who are indicating high anxiety or high depression would be classified as moderate to severe on this particular scale, with the most common symptoms, and this has been consistent through the whole poll, in terms of being tired out, everything was an effort, and nervous are almost always the highest sort of symptoms that we indicate as we go forward for this. Next slide. So this is the general anxiety disorder, or GAD-7. I'm sure most of you are familiar with this test. What's certainly interesting to me is the difference that we see in the age groups here, with 18 to 34-year-old being 7% severe, 13% moderate, which compares to those 55 plus who are 3% severe, 4% moderate. You know, and there is also an increase among women who are showing severe versus men, and moderate as well too. So we see specific groups. It's consistent with the self-rated scales, although of course the numbers are not as high, but this has not moved. And I think that's been an interesting question for us, which was, would this be the first time we saw a significant drop in the number of people with moderate to severe on the anxiety disorder that coincide with the reduction in self-rated mental health? And we haven't actually seen it yet. And I've been talking to a few other folks who have been running similar GAD-7 or PHQs on population-wide, and they haven't seen a drop yet either. So I think we're not quite out of the woods in terms of improvement on mental health, despite the fact that in some groups we are seeing an improvement on self-rated scales. Next. And again, this is the PHQ-9, the test for typically used to look at depression. So again, the numbers have not moved from poll 6, where it was 9% who had moderate and 5% severe. It's now 8 and 5, so 13% combined. And again, while there is some difference between younger and middle age, as a similar 7%, 6%, 55 plus is only 3%. So again, this does skew younger, this is something that has not moved. But again, our self-rated scale hadn't moved on this either. So this has not moved significantly since we started tracking it. Next.
Thank you, Michael. So here we want to see, because social isolation was such a huge factor influencing negative mental health of Canadians, we wanted to understand where people thought they would be 2 months from now if social isolation restrictions stayed in place. And though it has declined a little bit since polls 5 and 6, it is still quite high, and that 16% of Canadians believe that their level of anxiety will be high if social isolation continues for another 2 months. The same can be seen with self-rated levels of depression as well. As we've seen before, Canadians living in Ontario could be largely, due to the high levels of restrictions, but Canadians living in Ontario are most likely to anticipate high levels of both anxiety and depression. And younger Canadians are anticipating high levels of anxiety and depression as well if the social isolation continues. So again, we are looking forward to seeing what the results of the next poll look like. We're feeling cautiously optimistic. And again, of course, frontline healthcare workers are also anticipating very high levels of high anxiety and depression, and both have gone up significantly since our last poll. This is a little bit more of a breakdown in terms of provincial feelings of anticipated anxiety and depression. And as we can see, of course, Ontario is the highest. Quebec continues to be the lowest. We want to understand how Canadians, are feeling about their ability to manage their feelings of stress, anxiety, and depression. So we looked at how this has been affected by COVID-19, of course, and consistent with our poll 6 findings, the proportion of Canadians who say they're doing well has dropped. And young people are, as we're seeing a trend, are feeling less likely to manage their stress well, or feeling like they have less of an ability to manage their stress well. Did you either of you want to add anything before I move on?
Nope.
No, keep going. All right. So direct impacts on mental health. So we use the Sheehan disability scale to understand the actual, day-to-day impacts that mental health challenges are having on Canadians. So here we wanted to understand, how many Canadians are actually feeling like their days are being affected, and 29% of our entire sample said that their mental health challenges are having an effect on their ability to function. And it seems that the part of day-to-day life of seeing the biggest impact is social life and leisure activities, with school or work and family life or home responsibilities also taking quite a hit. And again, we're seeing that women and younger Canadians, as well as people who are employed and people who have already been diagnosed with mood disorder, are seeing the biggest impacts. And we also want to understand that if people are losing time, how much time are they losing? And 8% of Canadians who said that they'd been impacted are saying that they're actually losing days of the week. While younger Canadians are more likely to lose days, we're seeing that 35 to 50-year-olds are losing more days when they lose, but the average amount is about 3 days a week, which is, it's quite an impact for sure. But these findings are quite consistent with Poll 6. Sorry about that. There we go. As are those who are saying that even if they're not necessarily losing days of school or work, they are losing productivity. So 26% of people who are saying that they're feeling impacted are saying that their productivity has been seriously hit. Going back again, we covered this a little bit, but again, these results are quite consistent with our Poll 6 findings, and that suicide ideation amongst Canadians is it's quite troubling. These numbers are fairly staggering, and that 13% of Canadians have thought about suicide in the past year, and that 2% of our Canadian sample have planned a suicide attempt in the past year. And again, we are seeing that younger Canadians are experiencing this at a disproportionate rate.
I just want to pop in here to say that of course, 8%, 9% together don't equal 13%, but people could select multiple things. So if they had thought about suicide in the last 3 months and in the last year, we merged those data together, and it was 13% merged together. So we reduced the duplication. Just want to be clear.
Thank you. These are just kind of some of the markers of the things that are having a negative impact on Canadians since COVID-19, and we have covered a lot of these. Social isolation is still a very big factor. It has decreased a little bit, but it is still the leading factor in negative mental health, according to Canadians. Fear of contracting COVID-19 is also declining a little bit. It seems that fear of family contracting COVID-19 is continuing to have more of a negative impact than contracting COVID-19 yourself, which is really interesting. And here we're going to see a little bit more of a breakdown of that. We can see social isolation is at 48%, which is down a little bit from last poll at 52. It seems, coming into the summer months, supporting my child's needs, though it was never, among the highest, but with school being out, maybe that might be a bit of an improvement.
I'm just going to pop in here to say, as you can tell, the data on these slides are getting very cluttered as a result of how many polls we're doing, and we've talked about it. I think going forward, we will be reporting historically every second poll. So we'll do poll 1, 3, 5, 7, and then 8 for our next one. So if you're interested in the polls 2, 4, 6 data, you'll have to go back to a previous report, and every second poll will just do odd and evens. It's just getting too cluttered and it's unreadable almost soon. So just for future reference, anyone following along on this work.
So we are seeing the economy is remaining a stressor for Canadians, and it is having a disproportionate impact on younger Canadians still. We are seeing a slight improvement in the negative impact on mental health, but it seems that the economic downturn is, in terms of the economy, is the most negative factor. Also, daily news about COVID-19 is still a pretty negative factor. It's gone down a little bit. It might be due to people's, ability to shut it out a little bit more. Maybe people are just getting used to it, but it is declining a little bit in its negative impact. Still is not doing great things for Canadians' mental health. So going outside, we're seeing, I'm just going to move on to the next slide so we can see a bit of a breakdown, but going outside is still showing the most positive impact on Canadians' mental health. This has decreased, as we can see, a little bit since poll 6 from 47% to 41%. We've theorized that our poll 6 was right at the beginning of spring. There's that feeling of thankfulness of the warm weather, and maybe that's just kind of starting to ebb a little bit, but it still is having a very positive impact. And here we wanted to look at the rates of alcohol and cannabis consumption since the onset of COVID-19. Not much of a story here, not much of a change. Basically, consumption increased at the start of the pandemic, and really it hasn't gone down yet, not significantly anyway. So the results are pretty consistent throughout our polls in terms of use. Again, we've touched on this a little bit, but Canadians' confidence in their own abilities to overcome COVID-19 challenges has decreased. Younger Canadians are certainly struggling a little bit more. They're not nearly as confident in their ability to bounce back as older Canadians.
Sorry, just one quick correction, not COVID-19 concerns, overall challenges in their life. Challenges and unexpected troubles you have faced in your life. So this is an overall resiliency measure. Very consistent.
Thank you. Before we move on to vaccine, I do want to take another quick pause because we did cover a lot of information. Maybe give a few seconds if anybody wants to jump in with a question.
We do like questions. We're pretty well versed in our work, so if there are questions, we're happy to take them, especially Leslie. Nope, no questions.
All right, we'll carry on. So a little bit deeper dive into our vaccine analysis. So we found that 83% of Canadians have received at least one dose of a COVID-19 vaccine. And we have found that though getting a vaccine hasn't had much of an impact on feelings of high anxiety, which was for myself a little bit of a surprise for sure. But we have found, as I mentioned, that those who are not vaccinated are more likely to be experiencing high self-rated depression. And this is interesting because we have found that a correlation between not wanting to get the vaccine and high self-rated levels of depression. We've also seen in previous polls a correlation between high self-rated levels of depression and not following COVID-19, social distancing guidelines. So we found that to be an interesting kind of continuation or correlation on both those fronts.
Yeah, I just want to add 83% is a little above what the actual level of Canadian vaccination is. For 12 plus is 80%. But we're only looking at those over 16. So our numbers are going to be a little bit high. And there's also a few different biases at play here in terms of our sample will always be a little more, you have to have internet connectivity. So there's a few different biases at play that move it off by 1 or 2%. But it's relatively and pretty close when you actually factor in, especially the missing 12 to 15-year-olds, which have a lower rate of vaccination than 66% in the country.
I do see a question here, Michael, if you want to address it now. It's from Tamara Rossler.
Yeah, we'll actually get to that on the next slide. She's asking about the difference between, so we have multiple categories here. We've looked at the vaccinated, full double, single vaccinated. We've looked at people who still want the vaccinated and eager to get it, the people who are slightly hesitant, very hesitant, and absolutely not. And we'll answer that on the next slide.
And yeah, here we are. So we're seeing that of the 17% of Canadians, or of 16 to 55 plus, who have not received a first dose of vaccine, 36% of those Canadians are planning on getting one. So as I mentioned, an interesting thing was levels of self-rated depression did change based on people's levels of vaccine hesitancy. So we found that people who were not going to get the vaccine at all had very, very high levels of hesitancy. We're at 22% for high self-rated levels of depression, whereas those who are excited to get the vaccine were at 16%. So that's a fairly significant difference that we found very interesting. I don't know if Michael or Leslie want to add anything else here.
Yeah, there's a lot of data on this slide. And so to be clear, of the people who are not yet vaccinated, 36% are saying they are probably, or they're excited or probably going to get a vaccine. Of the 17% that are not vaccinated at all, 53% of those, so just over half, are saying they're unlikely or never going to get vaccine. So we looked at 4 different categories here. I'm excited at the prospect, which had a level of depression 16%. Which is right around the average, is 15% or 15%. The people who might wait, which would be the second category, was 23%. The people who are definitely going to wait, so that third category, I am concerned about a vaccine, was 18%. And the people who will not get it are 20 at all, the lowest category that we offered, which is that 27% at the bottom of that middle slide, where 22% of those indicated that they had high depression. Hopefully that clarifies a bit. It's not quite a linear curve. It's basically, and then there's a blip a little bit where that will go down, but it's just outside of the margin. But the people who are most resistant and the people who are slightly resistant are also the worst in terms of self-rated depression, highest levels.
Thank you. Leslie, do you have anything to add, or should I move on?
No, I think you can move on.
Gotcha. Okay, so here we wanted to understand, like, once sorry, construction outside my apartment's very, very heavy today. Once, the government declares that the COVID-19 pandemic's over, once we get back to a sense of normalcy, are Canadians still going to be feeling quite concerned about the pandemic? And almost 2/3 of Canadians say that they are going to remain concerned. Concern is lowest in Quebec and highest in Ontario, as we've seen in kind of other areas. I'm not sure if there's anything else that we want to cover here. Michael, is there anything that you wanted to add?
No, I'm just noting that the question from Tamara also identified the question of people who can't get the vaccine because of a medical reason. We did have a not applicable there, which they probably answered for, but we could further refine that question going forward to look at the I cannot due to a medical issue, and I think that would be an interesting thing to capture. So just adding on Tamara's comment. In terms of the net concern, it was just fascinating to see it go from 71 to 63%. 63%. Yeah, I mean, I think it shows that Canadians are still highly concerned around the virus. There was a Leger poll out this morning indicating a high degree of people concerned about going back to work. It was 56% of people did not want to go back to work in the office because of concerns around COVID. So there is a significant chunk of the population still significantly concerned about COVID-19 and Delta. We saw that in our open-ended questions as well. The Delta was scaring a lot of people.
Here we looked at Canadians who are accessing mental health care in the year before versus since COVID has begun. And we are seeing that there has been an increase in Canadians who are accessing mental health care. It's gone from 12% pre-COVID to 20% post-COVID. And this is a question for our entire national sample. And it has increased by 2% since our most recent poll in April. I think that one of the things for me that stand out that I always look at are the Canadians who say that they needed mental health supports but are not yet receiving it, and that has gone up 5% since the pandemic began and has remained pretty consistent with our last poll in April. I don't know if there's any other standouts that anybody wants to jump on.
No, I just think it's fascinating to understand why people are accessing.
Yes, and that's what we are going to look at next. So here we got to see these are the reasons that Canadians weren't accessing mental health support before COVID-19. So we're seeing that pre-COVID-19, 72% of Canadians who are accessing mental health support were satisfied with the care that they were receiving. But we also wanted to know of those who needed mental health support or felt they needed mental health support but didn't access it. We wanted to know why. So the primary reason that we've seen before COVID-19 is that they preferred to manage it themselves. And the second reason that was a cost factor. People couldn't afford to pay or perhaps didn't have benefits. But then we looked again after COVID-19. And what's interesting to me here is, actually, I'll get to that in a minute. We did see that the amount of people who were accessing mental health care who were satisfied was 78%. So actually up a little bit, I believe, since pre-COVID levels. And reasons for not accessing mental health support since COVID-19 in this poll stayed the same. Prefer to manage yourself or you couldn't afford to pay. But something that's interesting is that in our poll 6 report, I don't know if anybody remembers, but not being able to pay for care had moved way down the list. So it was really interesting to see this poll that it had moved back up. So that's something that we're certainly going to continue to monitor to see if that was a blip or if it's a kind of a consistent change. And I don't know if either of you have anything to add onto this slide.
Nope. I think we're coming towards the end.
Yes, that's
right.
it.
So I'm cognizant. I like to keep things on schedule and on time, and we have 4 minutes left according to my watch. What I really wanted to touch on, 2 things. One, I want to throw it out for any additional questions. And 2, just to let you know, we've enhanced our capacity to do some deep dive analysis on a merged data set of all the polls merged together, trying to understand some samples, and get deeper into some of these groups and multiple crosstab analysis. So one of the questions we saw, for example, was do we have any information about how young people are accessing need for care? And that is the sort of thing that we need a multiple sample, a more merged data set to actually report on, because if you look at just the youngest populations, 18 to 24, and then you wanted to look at just those people accessing care and what kind of care they're accessing, there's so many levels down and so many crosstabs. You want to make sure you get a merged data set. So we've started publishing on our website under a header called Research Briefs, a number of analyses that we're doing on merged data sets, which look at things like need for care, who's accessing services. The big one we're working on right now is a workplace analysis. So we're looking at a sector by sector to understand exactly how each sector was affected on employment, by employment sectors. And then the other one we're doing a deep dive is multiple covariables along with LGBTQ. So we're trying to understand age in LGBTQ, province in LGBTQ, and a number of other factors with that group as well too. So I would encourage everyone, if you're looking for some deep dives, ask us, and we can see if we have it handy. And if we don't have it handy, it might be on the research briefs. And if we don't have it there, we're always looking for input to understand how we can analyze our data in a unique way. We're pretty comprehensive, but there's always more ways you can look at it. So fire us those questions, and we would be keen to figure out the answer for you. I'm just going to throw it out for questions. Can we stop sharing screen? Is that okay?
Yeah.
Any questions? I'll wait another 30 seconds, but it looks like we don't have a lot of questions. That means we're comprehensive. Oh, one popped in. Oh, it's our pleasure, Tamara. Again, if Tamara asked a question about young people in need for care, we do have a need for care research brief up on our page. I can't remember off the top of my head whether or not we did an analysis by you. Maybe you remember, Brittany?
I want to say yes, but I can't say for sure.
We've done a lot of them now, so it's hard to remember all of them. But take a look at the website under research briefs, and there should be something there. If not, we can certainly add it. It's a good question. Leslie, anything else you want to add?
No, I think it's going to be interesting moving forward as things are opening more. What's going to happen, and you know, I think it was very telling that the anxiety and depression hasn't gone down as much as I thought it might, but it was going down a bit. So we'll see, it'll be interesting to see what happens next.
Our next poll is poll 8, which we are planning to implement on our timeline would be about the middle of August. So I'm just doing consultations with many groups to figure out what else we might want to adjust on it. We've been pretty stable with our poll since poll 6. We haven't made a lot of changes, but there's a few things we've been looking at in terms of hopefulness and a few other specific questions around burnout, which have been coming up regularly. So we've been having a lot of those conversations. If you have things that you want to know that we're not asking, send it our way. We'll certainly consider it. But I appreciate all your time, and thank you so much for joining us today. Thank you.
Bye.